My name is Elizabeth Harris, and I'll be talking with you today about Module 10 in this course on professional responsibilities and boundaries. The learning objectives are here on the screen now and will provide the structure to this presentation. So I think if you just look at the learning objectives, then you'll find that this is the way I'm presenting the material in this presentation. The first thing to ask is, why is privacy and confidentiality important? Adherence to privacy and confidentiality gives patients the confidence that anything they may tell their health worker will be kept in confidence and will increase the trust they have with the health service when they know that nothing they tell health providers will be released to other people without their permission. What is privacy and confidentiality? Although we often use these words as if they are the same thing, there is some difference. Privacy is action which is taken to prevent your privacy and is often dealt with through the legal system through privacy acts. Medical confidentiality, on the other hand, is an ethical duty, and it is often reflected in our professional codes of conduct or policy and practices of the health services where you are working. Community health navigators must ensure that any information they may learn about a patient or their family is not communicated to anyone outside the health system without the patient's consent. Generally, there should be a written consent. There are two examples where confidentiality can be broken. The first one is if there is a concern that the patient may hurt themselves or someone else if this information is not disclosed. For example, in cases of domestic violence or where a person is threatening to kill themselves. Secondly, if there is a concern that a child may be at risk of harm. Also, there is some provision that the police may request access to information, particularly for court hearings. There are serious consequences for health workers if they break confidentiality. If the break of confidentiality is confirmed, it can lead to disciplinary action or even dismissal. In very serious cases, it also may become a matter for the police or law courts. If you suspect there has been a breach in confidentiality, the community navigators should immediately contact their supervising, outline in detail what they suspect has happened, and also to keep a record of this. It is not advisable to confront the person who you feel has committed the act of breach of confidentiality. There are many types of information that are covered by confidentiality in the health system. These may be on paper or electronic and are constantly changing. They include your personal health record, any phone records, appointment bookings, notes on prescriptions, tests, results of tests, or referral letters to specialists or other services. Health information should only be accessed by those who have a legitimate reason and should not be copied or taken from the practice. It is very important to know that the person that you are providing information to has the permission of the patient for this information to be passed on. An example of a breach of confidentiality. Your patient has a history of mental health problems. One of their relatives comes to see you and asks if they do have a mental health problem. You say yes they do, but that you are not allowed to discuss details of their medical condition. Just by agreeing that they have a mental health problem, you have in fact breached confidentiality. There are a number of steps that we can take in our day-to-day work to minimise the risk of breaching confidentiality. All staff should know the guidelines for confidentiality, and they should form basis for their orientation programs. All medical records, both paper and electronic, should be securely stored using passwords or locking computer screens when you're not there. Having conversations with phones in the waiting room is not a good idea, and that patients should be provided with a private space if you are discussing private issues with them. You should also make sure that any letters or faxes are sent to the correct address. Because community health navigators are health professionals, it is very important that they recognise the boundaries in which they operate. It is very easy to forget the boundaries that you have, and often these become clear by the culture of the people around you. So one thing that is difficult, particularly around Christmas time or when something has gone especially right for a patient, is whether you should accept gifts without talking to your supervisor. You should never or rarely disclose your own personal information to patients. For example, telling them I've also had postnatal depression and this is how I coped with it, or inviting them home or taking them in your own car out of hours to appointments. Today it is also not advisable to make physical contact with patients unless you have checked with them that this is okay. Some people are reluctant to be touched by people who they may regard as strangers. It is very important that you take care of yourself. It is easy when you are in a helping profession to consider yourself irreplaceable. This is not the case, and so you should take time out, make sure that you live a healthy lifestyle, and you will last longer in your job. Thank you.